For most simple arthroscopies, patient can go home the same afternoon or evening.
Here's a basic checklist of reminders and things to be aware of before you come into hospital for your arthroscopy surgery. A few weeks before your operation, you will attend a pre-assessment clinic where a thorough medical assessment will be carried out to make sure you are fit enough to cope with the surgery.
Now I just need to ask you some medical questions. At pre-assessment you'll be medically checked to make sure you're fit and well, that you have no infections, and you'll have a chance to see your doctors and discuss the operation with them.
At the clinic, you'll go through a number of routine tests, including urine, blood pressure and ECG. You'll also be screened for MRSA and MSSA. This appointment is a good opportunity to speak to the medical team and go through any questions you may have. You'll also be asked to sign a consent form. Remember, many of the same tests will take place when you come into hospital for the operation itself, and you'll be asked to sign a consent form once again. Even for a simple arthroscopy, there are a few things you need to be aware of before you come into hospital, so that everything goes smoothly after the operation.
The only restrictions on them after a straightforward arthroscopy are to keep it dry for 48 hours, shouldn't dry for 48 hours, but after that, pretty much can do what you like. Usually tell them to keep it off work for about a week, maybe 2 weeks if they have got a relatively physical job.
Of course, you will have the chance to go through any specific restrictions that apply to you before you go home after surgery. Remember, you won't be able to drive straight away, so you'll need to arrange transport to and from the hospital before your operation. Be aware that any teeth or skin infections could mean that the operation is delayed.
Make sure that you've been to the dentist recently and get your teeth checked out, because any gum infections or tooth infections can affect whether you have the operation. Don't have cuts, scrapes or bruises or damage to your legs prior to the operation, because that will postpone you.
If you'd like more information, check out the arthroscopy booklet, which you can find in the resources section of the website.